You've been told to stretch, and you've been told to strengthen. Maybe you even had therapy or surgery, but your shoulder still hurts. I've seen this over and over again in my 20 years as a physical therapist, but here's the truth. Most treatment focuses on the basics and misses 3 key things. Once I unlocked these, my results with patients skyrocketed. It comes down to 2 types of movements. One is obvious, the other almost no one talks about. In this video, I'll show you the exact recipe to fix your shoulder pain using both. There's 4 main movements of the shoulder: forward or flexion like you would reaching into a cabinet or brushing your teeth, out to the side or abduction like you would to put on a coat, external rotation like you would to grab a seatbelt or to wash the back of your neck, and internal rotation like you would to tuck in the back of your shirt or pour from a pitcher. The first movement is that shoulder flexion or moving the arm in front. Now, normally in therapy and on YouTube, you'll see exercises to strengthen the rotator cuff and to work on the deltoid and strength of elevating the arm. This can be done with TheraBand resistance. This is done with dumbbells, and sometimes just the weight of your arm is enough to resist and strengthen the shoulder. If just the weight of the arm is too much, sometimes we'll use a wall and do wall walks for shoulder flexion or forward movement of the arm, or taking gravity out of the equation and lying on your back and lifting the arm. For the lesser known secret movement of shoulder flexion, which is lifting your arm forward, we're going to go into the thoracic spine or the middle part of your back and make sure that it can extend. Now, this movement, more than any of the other ones showing you, has completely transformed how I treat shoulder pain patients and has made some of the biggest differences in that. Reason being, most people have very poor thoracic extension, the ability of your middle back to arch backward. Obviously, that's related to so many of the jobs that we have sitting where we're rounded all day long. We're not exposing our spine to a lot of extension. So we can tackle that by using a foam roller. This is a little bit more specific to the spine because of this indentation that this has here. I'll have a link for this in the video description. This is probably my favorite mobilization, self-mobilization, self-stretch tool for the spine. Your spinal column, your vertebrae, bones that stick out the back can rest in this groove, and you can get a real good stretch through these 2 mobilizing bodies there. And I place that in the middle part of my spine below the shoulder blades, and then I'm going to extend the middle part of the back while I flex the shoulders. And you just work, those segments are only about that far apart, so you just take yourself down 1 inch at a time, and you're going to find where you're most restricted, and that's the area where you want to focus. Now, the key is, before you do this exercise, find where your pain is when you lift your arm. So if I lift my arm and the pain is here, I go through my reps on this exercise, and then I reassess after to see if it made a difference. And I can find, where do I get the greatest bang for my buck? Which part of my spine do I work? And then find my range of motion improves without pain the most. You just take yourself through 10 reps at that spot, reassess, make sure it's working, and then you can cycle through that 3 times a day or do 3 sets of 10. Try to do it every day until you feel like you're getting more range of motion without pain. If you don't have a mobilizing tool like the one I just showed, you can simply grab a tennis ball and do that on one side at a time, starting on the more painful side. So if your right shoulder is your problem side, use the ball on the right side of your spine, just off the spine bone in that little gutter, and then go through the same thing. I would do 1 arm at a time using the tennis ball. Now, you can certainly get 2 tennis balls and tape them together to mimic what we were doing with that mobilizing tool. But this sometimes, because it allows a little more range of motion, can be even more painful, but sometimes even more effective. This all ties back to the fact that we are not able to fully elevate our arm forward without our thoracic spine extending. So if I round forward, I can only lift my arm to about here. But once I extend my thoracic spine, I have full range of motion without pain. For shoulder abduction, we'll use resistance bands, strengthening the arm out to the side. We'll use dumbbells, strengthening the arm out to the side. If that's too difficult, we'll just work on strengthening without any weight. And if that's even too difficult, we'll go and use the wall as our wall walk or wall slides, placing your hand in a pillowcase up and down. But the lesser known secret movement for shoulder abduction or lifting your arm out to the side is the ability of your rib cage to expand on that painful side. So if my rib cage can't elevate, it's just like that shoulder going forward and the spine not being able to extend. So I can get to about here, but if I keep my ribs compressed, that's about it. In order for me to get full elevation, I need full expansion of this rib cage, just like an accordion would open. So one of the exercises that we like to do is starting on your side, and you can place a pillow under your ribs to open even further, but just start off without it. And then you're bringing this arm up overhead and then seeing, can you take a deep breath in and trying to open up that rib cage as much as possible. This is a good general stretch. And you're not bringing your arm into full overhead abduction, so it shouldn't be painful. If it is, just bring it down more. And you're just trying to open with a deep breath. Take 5 deep breaths and then reassess your ability to lift that arm overhead and see if it makes a difference. The sitting or standing upright version of that would be to bring your spine into side bending. And then again, deep breath. You'll feel a massive stretch through that outside part of your rib cage. Hold that for 5 seconds and then slowly exhale. You can add shoulder elevation into that. Put your hand behind your head and you'll get even more of a stretch through there. With all the exercises then, reassess. Do I have more range of motion? If so, great news. The exercises that you'll see for external rotation is to have a resistance band anchored, and then at your side, you rotate outward. This is going to strengthen that back part of the rotator cuff, which is incredibly important, but oftentimes this misses the mark. Lying on your side is one of the most common ways we'll use to strengthen external rotation. If that's too difficult, even just lying on your back, allowing gravity to assist the motion into external rotation. For internal rotation, one of the more common exercises we'll do is that resistance band, and you guessed it, pulling it into internal rotation. This muscle tends to be stronger than external rotation, so we focus on restoring that balance between external rotation, pulling it away, and internal rotation, pulling it in. You want to make sure that you have good external rotation to internal rotation strength, and you can see that by focusing on that same color resistance band and being able to do maybe 60% of the number of reps. So if I could do 10 reps before I get tired pulling in, I should be able to do 6 going out. Just figure out the math for the number of reps. If you're using weight for the exercise, you should be able to do about 60 or 70% for the external rotation poundage that you can do for the internal rotation poundage. If shoulder rotation externally or away from the body is your problem, then we need to work on, of course, strengthening that back part of the rotator cuff that we talked about. But that lesser known secret movement, again, comes into the thoracic spine rib cage. So our ability of our even shoulder blade to be able to tip backward and our rib cage to be able to expand and glide forward is going to permit that full range of motion. So if I show you again from the side, if I'm flexed forward, I can't externally rotate more than about that. As soon as I extend my thoracic spine, let my ribs glide forward, pin my shoulder blade to my spine, I have full external rotation. So if you're lacking in any of these areas, you're not going to be able to get full range of motion. And what can we do to improve that? Well, you can use that same thoracic spine extension stretch that we showed you for the forward lifting of the arm. We can add more of a rib stretch by wrapping a towel around our rib cage and then trying to bring that forward as we extend. And breathe in. Hold that 5 seconds and exhale. Keep the pressure forward and then relax. Bring that up. Pull forward as we breathe in deeply. And we can work that up different levels on the rib cage each time when we breathe in. You can also use a foam roll, and if you don't have one, just roll up a towel tightly and place that off to the side so it's just on your painful side's rib cage. And I place that down over on the rib and then go into my external rotation with a deep breath, and you'll feel that foam roll or towel drive your ribs forward, allowing you to gain more shoulder external rotation. Get back, deep breath in. And you can feel that stretch directed right where the towel is. And we just work that until we find where we get the most relief and improvement in our range of motion. For the internal rotation component, we need our ribs to go backwards, so we can use that same towel roll or foam roll, and we're gonna place it on the front of the ribs, driving them backwards off the edge of the bed or a table. I place that on that rib, and then we wanna exhale when we do this one. So I'm trying to get my internal rotation as that foam or towel is pushing my ribs backward, assisting that shoulder rotation. The shoulder blade needs to be able to rotate forward without the ribs being able to drive backwards. That motion is going to be limited. You're going to get pinching and pain in your shoulder. Now, if all you do is stretch and you don't make any changes in your daily activities, you're not going to get as much carryover from the exercises. So we want to make sure that the number one thing we do throughout the day, which is breathe, uses that new rib and spine range of motion. So most people, when they breathe, are overusing their upper ribs, their upper respiratory breathing, by elevating their shoulders. That's why so many people have stress and pain in their shoulders. And by changing how you breathe, you can make a pretty considerable impact on that. So we want to allow, just like if we filled up a bucket with water, it would fill up from the bottom up. We want to fill our lungs from the bottom up. So when we breathe in, there should be slight movement forward because our diaphragm goes down. The belly should expand slightly, but then as soon as we can, we want these lower ribs to expand. Again, picture that bucket's filling up with water, it's expanding down at the bottom. If it were fluid and dynamic, those ribs go out, air goes in, and then only when you're trying to maximally fill your lungs would you actually elevate at the top part of your ribs. Okay, only when we're filling that bucket maximally. So most of your daily breath should be happening with the lower part of the ribs and the lower part of the abdomen moving. Okay, so again, it's in here and then out. And you can help retrain that by placing your hands on the outside of the ribs, feeling those hands separate, and then when you exhale, force them in and even give a little extra squeeze. In, out. Keep working on this until it becomes automatic and you have good expansion of your ribs out to the side. The direction people have the most trouble with breathing is getting their ribs to move backward when they breathe in. So when you breathe in lying down, it's a good way to determine if you're getting that posterior or backward rib movement. So breathing here, I want to feel like I'm able to push down into the table a bit. This is going to work best on a floor or a firm surface. You won't get the feedback as much if you try this on your bed. But I'm just working on, again, expanding here, but then also feeling like, can I push down with this lower part of my ribs into the floor? This is the main missing part of people's breath work, the ability to breathe in a 360-degree direction, not just outside, but also backward. You master that, you'll have carryover from most of the techniques that we showed, and you should have improvement in your shoulder motion in all directions. Now that you know the secrets, you may still need to strengthen some of the basics of your shoulder. To watch a video on that, click here. Subscribe to my channel for pain and arthritis tips 40 and up. Click here.